part of the art of doing a knee replacement is to put the knee in with the proper balancing. And so you want to have the extension, which is the knee straight, and the flexion at the proper positions with the proper tension. And in traditional knee replacements, it's a kind of a feel that surgeons have. Does it feel too tight, too loose? Every surgeon has different preferences as to how to put their knee in. Sometimes patients end up with a stiff knee. You thought you put it in properly. Sometimes they end up with a loose knee. Now, through the technology offered by a company called Orthosensor, there's a device called Verasense, which is a polyethylene type insert which has microchips in it, which we put into the knee during the replacement testing part of the surgery. Once the implants are in and we're testing to see if we're too tight and too loose, we put in a device which is opened up sterile on the field and is disposable. It has microchips in it, which are sensors that check the pressure in the joint. So if the knee is placed into extension and made straight and there's too much pressure on one side, it'll register on the computer screen. And if there is no pressure on it, that means that the implant is, the alignment is too loose, and you have to put in a thicker plastic or do some releases and modify your balancing. So this smart technology lets us make sure that the knee is put in with the proper balancing, so the knee comes out with the best chance of having a perfect range of motion. The way this works is when the Orthosensor Verasense implant is placed into the knee joint for trialing purposes during the surgery, it's going to sense the amount of pressure on the medial side, that's the inside of the knee, and the lateral side, with the knee in various points in range of motion. So as I put pressure on the lateral portion here with my finger, you're going to see it's going to start to move up there. I can push as hard as I can, and I can get it only into the 30s. There's times you put the knee in and it's over 100, which is extremely tight, and that would be very painful for the patient. You want to see the numbers be roughly within 20 pounds of each other. Each unit is a pound. So if we had a result such as this, when the insert is put in, that would be actually a good balance here. You want to avoid something that looks like this. This is considered too tight medially and not tight enough laterally. And same thing vice versa here. You like to see a bit of symmetry with this. So I think doing a total knee replacement or total hip replacement using these technologies makes it some of the most advanced surgeries in the world, actually.